what we think any incoming government will need to do in order to secure the future of the NHS. And I guess I'll start with what it needs to do immediately for the next Parliament. And really what we're calling on all political parties to commit to is firstly to commit to the £8 billion of additional funding by 2020-21, which NHS England identified as the minimum amount required in order to continue to deliver services through the next Parliament. It's very important that people commit to that up front so the NHS has clarity about what it's trying to achieve, because realising that £8 billion will require significant change in the service. That requires the NHS to substantially improve the rate of productivity in the health service. It can only do that if it starts to really make rapid progress on the reforms to the way we deliver care that were set out in the 5-year forward view. But that sort of change doesn't happen instantly, and it isn't cost-free. So change requires time of people, it requires skills, it requires physical investment in new services, in IT infrastructure. And so in addition to that £8 billion, we are calling for all political parties to support a transformation fund. And some of you may know we're working with the King's Fund on a project to really develop ideas for how a transformation fund might operate and how much resource it might need and how much of it might be possible to fund from the surplus assets held within the NHS. But I think one really important point to bear in mind is that the transformation fund is in addition to the £8 billion. The £8 billion that the NHS England called for is the running cost to keep services going. That it's not the cost of change as well. And I think one of the things we need to watch out for is people trying to say that the money for transformation can come from within the £8 billion. All the experience of other sectors is that change requires time and dedicated resource. And in a service as big and complex as the NHS, that is certainly true. The other thing to say is that the £8 billion is a minimum, and it's predicated on pretty low growth in pay for the NHS. Now the NHS has been able over the last 4 years to hold down earnings for permanent staff. But one of the things that our briefing points to is a very rapid increase in spending on temporary and agency staff. 28% increase in 1 year alone between in 2013-14. And in part this may reflect that pay policy starting to bite and difficulties recruiting and retaining permanent staff in that environment. So that needs to be recognised. So those two things: commit to the £8 billion of additional funding set out by NHS England and establish and properly resource a transformation fund. But as our analysis shows, the funding questions for the NHS don't go away at 2020. This is an ongoing challenge that we face. Over recent years, all governments have been able to increase health funding without increasing overall public spending. And they've done that essentially as other public services have reduced to create headroom. I think the work of the IFS and the OBR really clearly demonstrates the scope for big further cuts in other public services to create headroom for the NHS over this sort of 15-year time period is really limited. And we do need to reach a societal consensus about how much funding we want to put into our NHS, what sort of package of services we're going to need, and therefore how we are going to fund this. As this work shows, health funding is going to need to rise by more than GDP. Yeah? It's done that for the last 60 years, actually, until the current Parliament on average. And we're not alone in this. All other countries face a similar challenge. In fact, if governments did commit to increase health funding by the 2.9% in our central projections, we estimate that where we get to at the end of this period is we'd be spending broadly the average of all the EU 15 countries spend at the moment as a share of GDP. So it's a lot of money, yeah? But actually, in the scheme of things, most of those countries manage sustainable economies, notwithstanding the impact of the Great Recession, at spending levels that are slightly higher than ours. Yeah? So it is it is a big challenge, but it doesn't suggest a system which is inherently unaffordable and unsustainable.